Welcome to the medicine section. You've already had some exposure to the medicine section by now, but we're going to go over the main points. You should read all the guidelines in this section as it will help you through this course. The medicine section is very large. That's why you've already had exposure to it with some of the other organ systems that we've went over. This discussion comes at the end because it contains all those topics not covered in other sections. Due to the large size of the section, not every code or section will be covered in this lecture. The highlights and difficult areas will be considered. You should read through the guidelines. 90281 through 90399. Immune globulins are proteins given to protect against or prevent infections. These globulins are made from human blood or products created in a lab from human and animal protein. Infections are caused by bacteria, viruses, and fungi. When these products are given, administration codes are listed with product codes. Pay close attention to the method of delivery of the product. When delivery is by infusion or IV, codes listed later in the medicine section, 96365 through 96371, are used for reporting. Examples of these agents include immune globulin for exposure to hepatitis, cytomegalovirus, and rabies. Rh immune globulin is during pregnancy events, such as normal pregnancy, miscarriage, or ectopic, to prevent sensitization when the Rh negative mother is carrying an Rh positive baby. Remember to use specific ICD-10 codes to substitute medical necessity. Also, recall that all CPT codes for vaccine or toxoids are modifier 51 exempt. You should write that note in this section. Exposure to infectious agents and vaccine stimulates the immune system to make antibodies. Antibodies fight the current infection and future attacks by these foreign substances or germs. Vaccines are preparations of killed or attenuated strains of microbes such as bacteria, fungi, or viruses. Vaccines are given to stimulate an immune response with the production of antibodies. Vaccination is the administration of a vaccine. The flu or influenza vaccine is an example of a vaccine. Immunization is used as a synonym for vaccination. Both are given to protect susceptible individuals from diseases. A toxoid is a toxin that has been treated to destroy its toxic or harmful property and is capable of stimulating the production of antibodies against the toxin. For example, tetanus toxoid. The next section I want to talk about is the psychiatry section. Psychiatric services can both be outpatient and inpatient. This section contains several paragraphs of instructions and guidelines for review. Review these guidelines carefully. In some instances, it is okay to use an E&M code for services provided in the office. However, some codes stipulate this is not appropriate. These code listings can be used by several types of healthcare providers. This includes psychiatrists, psychologists, or clinical social workers, depending on the service. Some patients receive hospital evaluation and management services only, and others receive E&M services and other procedures. There are additional HCPCS codes required by some payers to clearly identify the type of provider of the service. Modifier 22 may be used to report a more extensive service. Modifier 52 may be used to report a service that is reduced or less extensive than the usual procedure. Psychiatric services can include psychotherapy, behavior modification, and addictive disease treatment. Consultation by psychiatric evaluation of a patient includes the exam of the patient and exchange of information with the primary physician, nurses, or family members. It also includes preparation of a report. These services do not include psychiatric treatment. Follow-up visits initiated by the physician, consultant, or patient are reported using E&M codes for established patients. When services consulting transfer of care are reported, new or established patient codes are reported. Psychiatrists often report 90785 through 90792 instead of E&M codes. Diagnostic psychiatric evaluations are done to determine if there is a treatable diagnosis. The code is chosen based on whether the medical services are performed in addition to the diagnostic evaluation. Now let's talk about dialysis. Dialysis is a form of filtration to remove toxins from blood. This function is usually performed by the kidneys. A semi-permeable membrane between blood and another solution is used to filter toxins out of blood. Patients with renal failure, acute or chronic, often require dialysis as often as 3 times per week. End-stage renal disease, ESRD, patients generally are awaiting a kidney transplant. Services for ERSD patients are age-specific and are reported once per month if provided in an outpatient setting. There are several possible areas of problems or complications with dialysis. It requires a lot of time, several hours per session, 3 times per week, and may cause infection, IV access site problems, hypotension, anemia, and embolism. This section contains a lot of instructions and guidelines that you should review. Dialysis is generally hemodialysis, filtering of the blood. Other types of dialysis include peritoneal dialysis and hemofiltration. Peritoneal dialysis is placement of a needle or catheter into the peritoneal space in the abdomen. Sterile fluid is placed into the peritoneal cavity and left to allow absorption of waste products. The fluid is then removed from the peritoneal cavity in the abdomen. Hemofiltration is similar to hemodialysis. Blood is pumped through the hemofilter and no dialysate is used. Salts and water lost through this process are replaced with substitution fluid. There are 2 codes for reporting dialysis training for the patient and also for helper dialysis training. Code 90989 reports complete training. Incomplete training is reported with 90993 for each training section. Training can take several weeks. The ophthalmologic section begins with E&M listings. The distinction is made between new and established patients. A new patient is one that has not received any professional services from the physician or other physician of the same specialty who is being seen in the same group practice within the last 3 years. An established patient is one who has received services from a physician or another physician in the group in the past 3 years. These services are not surgical. Special ophthalmological services include things such as fitting of lenses, assessment of eye muscles, contact lens services, and eyeglass services. Cardiovascular services are listed next, which include heart catheterization, stent placement, thrombectomy, and balloon angioplasty with a balloon of the coronary arteries, EKGs, echocardiograms, and electrophysiological evaluations. The non-invasive section contains a lot of sub-guidelines and parenthetical instructions to review carefully. These studies are reported for evaluation of blood flow in the head, extremities, viscera, and penis. These are tests done outside the body, not catheters or dyes. No catheters or dyes are used. The types of studies done are duplex scans and Doppler studies. Duplex scans are reported with ultrasound and confirm patterns and direction of blood flow. The scan produces real-time 2-dimensional images of the arteries and veins. A Doppler is a diagnostic instrument that emits an ultrasound beam into the body. This signal is reflected from moving structures like blood and vessels, and a computer-generated image is created. These codes include patient care required to perform the study. Now let's talk about allergy and immunology. An allergy is a hypersensitivity caused by exposure to a particular antigen, resulting in an increase in reactivity to that allergen upon subsequent exposure. Allergen testing 95004 takes place with allergenic extracts such as dust, pollen from plants, mold, and dog dander. Drug allergy testing 95017 through 95018 can include drugs, venoms, and biological agents. Biological agents are made from living organisms, including vaccines, serums, and antitoxins. Immunotherapy is also called desensitization, and it is the administration of allergenic extracts at periodic intervals with increasing dosage. It seeks to boost the immune system function. Rapid desensitization, code 95180, involves injection of an allergen in gradually increasing doses. It must be done under well-controlled conditions due to possible reactions. Sleep studies, or polysomnography, is becoming more and more common. These tests involve continuous and simultaneous monitoring and recording of various physiological and pathophysiological parameters of sleep for 6 or more hours. This includes physician review and interpretation with report. Although terms sleep studies and polysomnography are sometimes used interchangeably, there is a distinction. Polysomnography includes sleep staging, which includes a 1 to 4 lead EEG, an EOG, and a EMG. The codes are selected based on the study performed, additional parameters performed, and for some codes, the age of the patient. This section includes instructional notes that should be reviewed. EEG is recording of electric potentials of the brain. It is derived from electrodes attached to the scalp. An EMG is recording of electrical activity generated in muscle for diagnostic purposes. This includes nerve conduction studies. With nerve conduction testing, specific nerves are tested using electrodes. This section contains specific instructions regarding testing, which testing can be both sensory and motor. Reports must be prepared by the examiner on site. All of these sections listed of neurology and neuromuscular procedures contain instructions at the beginning of each section. Special EEG test codes 95950 through 95953 and 95956 are used per 24 hours of recording. A chromosome is a thread-like structure in the nucleus of a cell composed genes or the genetic material DNA. Human cells normally have 46 chromosomes and 23 pairs. One of each pair is contributed by the mother and the other by the father at conception. A gene is a hereditary unit. It occupies a fixed position in the chromosome. Genetics is the science of heredity. Medical genetics is the branch of human genetics concerned with the relationship between heredity and disease. This area of medicine is expanding rapidly as we learn more. Genetic counselors determine the genetic risk or hereditary disease of hereditary diseases. This is often done via in-depth family history and can include extensive research. These are time-based codes and documentation is key. Information gained and exchanged in these sessions is not usually exact. More often, the discussion is centered around the chances or the likelihood of the abnormality occurring. An example is cystic fibrosis, a congenital present-at-birth disease that is inherited from parents. If both parents are carriers of the gene for cystic fibrosis, their offspring have a 25% chance of having cystic fibrosis. A 25% chance of not being affected and a 50% chance of being carriers. If parents already have an infected child, they may want to know the risk of future offspring. Hydration for short. The title of this section is listed here. There are not a lot of codes in this section, but there are a lot of instructions. Infusion is the introduction of fluid into the body. When performed, the following services are included and not reported separately. Use of local anesthesia, IV start, access to indwelling IV or sub-Q catheter, flush at the conclusion of infusion, and standard tubing, syringes, and supplies. Those are all included. These services cover physician supervision of anyone giving the infusion or injection. E&M codes can be reported with codes from this range. When multiple drugs are given, report the services and the specific materials or drugs for each. A J code from your HCPCS manual is used to report the drug given. For example, if a patient is seen for strep throat and given penicillin injection, list an E&M code for the exam, and then 96372 for the administration of the injection, and then a J code for the actual injectable, which is penicillin in this case. If more than one infusion or injection is given at the same time, report only a single initial service code as 96360 or 96372. The exception of this is that the substances being administered have protocols that separate IV lines and sites are to be used. These injections can be therapeutic, prophylactic, or diagnostic. When fluid is used for the administration of the drug, the administration of the fluid is not separately reportable. These codes are very specific as to time, technique, substance added during the infusion time, and additional setup. They should not be reported by a physician when performed in a facility setting. That's a note you should write in this section. If multiple drugs are infusing at the same time through the same IV line, they are considered to be concurrent. If protocol indicates that 2 separate IV lines must be used, then the infusion is not concurrent. A sequential infusion occurs when a different drug is infused through the same access site after the completion of the initial infusion. Documentation supporting these issues is important. Chemotherapy is the treatment of disease by the means of chemical substance or drugs. Usually this is for malignancy. These codes are specific to time, technique, and additional substances added. Read the notes of explanation and instruction at the beginning of this section. Advanced training is required for the preparation and administration of these agents. This includes the infusion rates, handling, and disposal of chemotherapeutic drugs. There is a significant patient risk related to administration of chemotherapy. Substances given are prepared specifically for the patient and require advanced staff training to administer them. HCPCS Level 2 codes for chemotherapy drugs are listed in the J9 section. Techniques other than standard infusion or injection are used to deliver chemotherapy agents. Other techniques used include thoracocentesis, paranocentesis, intrathecal delivery, or ventricular reservoir. Paracentesis is the passage into a cavity with a needle or cannula to remove fluid or placement of medication. Thoracocentesis is the type of paracentesis, sometimes called pleural tap, which involves entry into the pleural cavity, a potential space between the lung and the chest wall. Peritonicentesis is paracentesis into the peritoneal cavity. Intrathecal delivery is for treatment of the central nervous system, CNS. Ventricular reservoir is for chemotherapy administered into the subarachnoid or intraventricular areas. If other medications are given during chemotherapy, such as for nausea, report them separately. Physical medicine and rehabilitation services are intended to improve functional loss. These services are usually provided to patients who have had a stroke, amputation, major cardiac event, or hip fractures. For some, these services are directed to restore the ability to perform activities. A treatment plan outlining problems and goals is developed by a physician. Therapy is implemented by a therapy center. Therapists involved in providing care can include physical therapy, occupational therapy, and speech therapy. Documentation requirements by the provider for the initial evaluation and reevaluation are extensive. Evaluations are reported based on the time of evaluation, the complexity of the evaluation, and if it is a reevaluation or initial evaluation. There are some G codes in the HCPCS book that must be added to Medicare claims to report the functional patient status, therapy goals, and progress. Active wound care management is next. Active wound care management is not just putting a piece of gauze on a wound and waiting for it to heal. Certain wounds in certain patients have wounds that will not heal. A good example of patients requiring active wound management is those with diabetes. Debridement is excision of devitalized tissue and the removal of all foreign matter from the wound surface. Necrotic tissue is dead tissue. For the wound to heal, this tissue must be removed. Certain types of bacteria thrive in dead tissue. There are various techniques used to clean wounds. Orthotics is the science of making and fitting an orthotic appliance. A prosthesis is a fabricated substitute for a diseased or missing part of your body. Prosthetics is the art and science of making and adjusting artificial parts of the body. Osteopathic medicine utilizes a concept of manipulative techniques along with traditional medicine. These techniques are used to treat somatic dysfunction. These listings are categorized by the number of body regions involved. Body regions include head, cervical, which is your neck, thoracic, which is your middle back, lumbar, your lower back, sacral and lower extremities, upper extremities, rib cage, abdomen, and viscera. Chiropractic medicine is the system of using a recuperative powers of the body and the relationship between the musculoskeletal structures and functions of the body, in particular the spinal column and nervous system in restoring and maintaining health. A chiropractor is one who is licensed and certified to practice chiropractic services. A qualified healthcare professional provides a service to a patient using internet resources in response to a patient's online inquiry. This must include permanent storage, either electronic or hard copy, of the encounter. This can be reported only once for the same episode of care during a 7-day period. That's a good note to write in this section. A reportable service includes all of the communication, telephone calls, prescription provision, orders for lab tests, and the online encounter. Let's talk about moderate sedation. Moderate sedation is between local and general anesthesia. The patient is still conscious and able to respond to verbal commands, but is in a drug-induced depression of consciousness. These patients are breathing on their own and not intubated. Moderate sedation does not include minimal sedation or deep sedation with monitoring. That's included in your anesthesia section. Your CPT code book lists the work included in moderate sedation, which includes pre-service, inter-service, and post-service work. Codes are selected based on the age of the patient, the provider of service, and the inter-service time of the moderate sedation. When the provider of the diagnostic or therapeutic service also performs the moderate sedation, an independent observer is required. These codes are reported by non-physician providers giving care in a home setting. So turn to your home health procedures and services. A home setting is defined as the environment in which a patient lives. When physicians provide services in a patient's residence, home visit codes in the NM section are reported. The medicine section codes are for non-physician practitioners. You should write that here. Home care for prenatal services could be for a pregnant patient on bed rest. Services provided could be the same as regular prenatal visits. A visit for postnatal follow-up care can be used to assess how the new mom is doing. Is she recovering normally and able to take care of her baby? This can be an opportunity to check in on feeding, breast, or bottle. Also a good time to discuss contraceptive choices. A serious problem often not considered is postpartum depression. This is an opportunity to evaluate the mom for this common concern. Newborn assessments at home can be very valuable and allow evaluation without having to bring the newborn out and exposure to children in the office. The home and social environment, infant nutrition, caregiver skills, parenting skills, and resources can be evaluated. Lastly, the home infusion procedure section. In these services, a home health provider brings all the supplies and medication to be given. The infusion is given under the direction of the provider. The infusion is given under the direction of the provider. These are time-based codes.